We are entering peak flu months, and some recent information suggests the most popular flu drugs don't work. It's not referring to flu vaccines. Those, doctors say, are reliable.
The study shows the actual drugs like Tamiflu and Relenza, the ones used to treat the flu, are not all that effective. KLTV 7 Summer Dash spoke with medical professionals who weighed in on the findings to see if you do not get the flu, if you manage to do that, if there's really anything you can do about it.
Thousands of Americans die from the flu each year, and according to a study by the Cochran Collaboration and independent medical research group, the drugs to treat it aren't helping. 24,000 patients who used Tamiflu were reviewed. The findings showed the drug did decrease symptoms just slightly by 17 hours, from 7 days to 6.3. Tyler area pharmacist David Davis says in his experience that sounds about right.
If you catch the flu and you were going to be sick for 7 days, maybe you're only sick for 6 days.
The study also found the drug didn't prevent pneumonia, a common secondary symptom of the flu that often lands patients in the emergency room.
Someone that catches the flu that would have ended up in the hospital anyway, the drug is probably not going to prevent that from the evidence that I've seen.
It also found no reduced risk of death. But Trinity Mother Francis pharmacist James Tyler disagrees.
They work best when given early on.
He says if given at the first sign of flu, Tamiflu and related drugs can help you feel better.
It would reduce the severity, so the body aches, the fever, general feeling of just feeling terrible all over.
But if given too late, would those drugs help at all?
I think it's not as clear. In general, I would say probably not.
The makers of Tamiflu issued this statement saying the company fundamentally disagrees with the overall conclusions and cited a study they funded last year showed the drug was associated with a reduction in the risk of death by 19%. Summer Dash, KLTV 7 News.
The CDC still lists antiviral drugs like Tamiflu as the recommended treatment for flu. Still, medical experts say the flu vaccine is your best defense. So if you have not gotten your flu vaccine yet, they encourage you to do so. We're told there is no serious shortage of any vaccine in the East Texas area, although the 4-strain vaccine recommended for the elderly has been going fast.
So we're getting into our first